Hello there. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. Let's talk about the Editor's Choice and Highlights articles in the June 2016 issue of Mayo Clinic Proceedings. But first, what do you think about the new design of our website? Let us know. We have worked really hard on the details for the last 2 years, and we'd be curious if you have suggestions for further improvements. The Editor's Choice in the June 2016 issue of Mayo Clinic Proceedings is an original article about the U.S. Food and Drug Administration's approval process for oncology drugs. Based on their data from a retrospective study of the FDA database, Dr. Chul Kim from the NIH and Dr. Vinay Prasad from the Oregon Health and Science University in Portland contend that the strength of the association between surrogate endpoints for drug approval and survival is not rigorously analyzed in more than half of accelerated approvals and more than 40% of traditional approvals. Dr. Vincent Rajkumar, one of our associate editors and a prominent hematologist, wrote a thoughtful editorial entitled "Striking the Right Balance Between Saving Lives and Patient Safety." The first highlight in our June 2016 issue is a brief report relating to the ACC-AHA pooled cohort equations to predict cardiovascular risk. You may remember that after the release of the new risk prediction tools, there were concerns about their validity and accuracy, and some of these concerns were voiced in 2 articles published in the September 2014 issue of Mayo Clinic Proceedings. In this month's article, Dr. Paulo Princi and Dr. Ovuokere Ado from the University of Mississippi used data from the 1999 to 2010 National Health and Nutrition Examination Survey, also known as NHANES, to address the predictive validity of the pooled cohort risk equations. Their findings are discussed in an accompanying editorial by Drs. Neil Stone and Donald Lloyd-Jones, who were both members of the writing group that created the original 2013 AHA-ACC guidelines. The second highlight in our June 2016 issue is a concise review for clinicians on emergency contraception. Drs. Palin Batur, Lisa Kransdorf, and Petra Casey from Cleveland Clinic and from the Arizona and Minnesota campuses of Mayo Clinic provide an overview of the mechanisms of action, adverse effects, availability, and relative efficacy of the 4 approved options of emergency contraception in the United States. You can get up to 1 hour of CME credit for reading this review article if you complete the appropriate documentation. Another highlight in our June 2016 issue is a commentary entitled 21st Century Women's Health, Refining with Precision, that was written by Dr. Marjorie Jenkins from the Texas Tech University Health Science Center in Austin, Texas, and Dr. Virginia Miller from Mayo Clinic in Rochester, Minnesota. They argue elegantly that conceptualized women's health is an important, perhaps the most important aspect of so-called personalized medicine, and that the idea of women's health should be disentangled from the political issues of women's rights. As usual for our highlights and editor's choices, you can access the articles we just discussed for free on our website during the entire month of June. And also as usual, they are absolutely not the only free articles on our Mayo Clinic Proceedings website this month. Go to www.mayoclinicproceedings.org. There is something new almost every day. Go take a look. If you connect with us on Facebook, Twitter, and YouTube while you're there, we can also keep you up to date on online first publications that appear before our monthly website updates and on news stories related to articles that were published in Mayo Clinic Proceedings. Thank you for tuning in. We'll see you again in July.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.